So you do a lot of laser liposuction. Tell me about it.
Yeah. Well, we do two things for liposuction. One of them is laser assisted. We have a laser that will soften the fat. And then once the fat is softened, then we use a device called power liposuction that will actually remove the fat. And here's the difference, Randy. When you do traditional liposuction, as most plastic surgeons do, you have a metal tube and you ram it in there very quickly trying to break up the fat. It's very traumatic. It's also somewhat dangerous because if somebody is ramming a tube in at high speed and they're going at the wrong angle, they could accidentally hit an internal organ. I mean, I've never had this happen, but it's a known possibility. Okay. Power liposuction, the tube is round on the end and there's holes down the side of it that will suction the fat, while the handpiece makes the tube vibrate back and forth 5,000 times a minute. Well, now you got a power-driven tool that's vibrating, and I can slowly go in and out like I'm playing a violin and precisely and carefully extract the fat anywhere I want it to be. So in addition, it's also very gentle on the patient, and the chance of an internal organ injury goes basically to zero because as long as you're in the fat, it's very soft.
So when you say gentle, by the way, on the patient,
yes.
So downtime?
Less downtime.
Is much improved?
Yes, yes. And redo liposuctions, I get a lot of redos from other offices. They're more challenging because there's some internal scar tissue in the fat that's harder to break up. But with our laser and power liposuction, we can break up that fat and get a lot more fat out that they couldn't get out the first time with traditional techniques. So yes, because it is more gentle, there's less swelling, less pain. They get back to work sooner, they get back to exercise sooner, okay? They can shower the next day. It's really been a huge improvement in my practice. And we can do liposuction in many areas. We can start with the fat underneath the chin. We can do the male chest. Some men get a little bit of fatty tissue there, which is very dense, it's hard to get out. The upper back is very dense, hard to get out. We can take care of that.
So like bra strap area for women?
Bra strap, yeah, exactly. The abdomen, the love handles or flanks we call them, outer thigh, inner thigh. We can do multiple areas at one time. We can do large volumes, you know, easily take out 5 liters in a day, which equates to about 11 pounds easily.
Is that right?
Yeah, yeah. And it's a very dramatic change. Now, here's what some people say, well, 11 pounds doesn't sound like a lot. Well, here's the difference. When you lose 11 pounds, you lose it head to toe, right? All your fat cells get a little bit smaller. If we spot reduce you 11 pounds, that's a huge amount of fat in one area to sculpt. Yeah, it's a matter of sculpting and giving people a beautiful shape when they're done.